Hello, this is my discussion 15 on the case of Graves' disease. So the first question is pretty simple. I'll just read it off my laptop. Name two hormones that are commonly referred as a thyroid hormone and describe their general action. So T3 and T4, those are the thyroid hormones. They increase metabolism, minimizing blood pressure and body temp and fat. Next question. Why would an overactive thyroid cause Krista's weight loss, sweating, and elevated heart rate? Because overactivity of those two hormones. Basically, the cause of weight loss and higher temp is because there's more hormones being used at that moment, causing more blood pressure, heart rate, and more sweats. It throws off the balance of metabolism, thus causing fatigue and weight loss as well. But our thyroid will help our heart levels regulate. So Krista wonders if TSH is a thyroid hormone, and Dr. Weisman explains that it's not. State the action of thyroid stimulating hormone, TSH, and name the gland that secretes it. So the gland that secretes is our anterior pituitary gland that secretes the TSH, thus raising the thyroid hormone. So you need your TSH in order to raise the T3 and T4, and this will only happen if it's monitored too low. So next question is, how is the secretion of TSH regulated under normal conditions? Basically, TSH is controlled by hypothyroidism, and normally when the two hormones are decreased, the TSH will begin to regulate the hormones. That way it performs homeostasis and everything can go back to its normal levels. levels. I don't know why I said it like that. But in Graves' disease, the immune system makes antibodies that stimulate TSH receptors on the thyroid gland. What effect does this have on Krista's thyroid? So basically, when you stimulate the TSH receptors, you make them less active, of course, because they assume that there's more like hormones going on, and that's being released, which makes the TSH lower and the receptors lower as well. Then T3 and T4 will go unaided to stop them. So it affects the TSH as well. And then 6, why is Krista TSH levels are low instead of high? Well, because if you don't have enough TSH, of course, that's going to be low. Then your receptors are going to be low, of course. So your receptors depend highly on your the act, of course, or not the act, but the TSH. And then if Krista's has been diagnosed with hyperthyroidism, what would happen to her levels of TSH and thyroid hormone? So same thing here. If your TSH would have been high, then that would regulate your T3 and T4 hormones to lower. And then lastly, a common treatment of Graves' disease involves ingesting a dose of radioactive iodine, which slowly destroys the thyroid glands. What other tissues are unaffected? The other tissues that wouldn't be affected would be other cells in the tissue, of course, and those are used to be absorbed the iodine without affecting other important organs, tissues, or cells as well. But after that, that's pretty much it. Thank you guys for watching, and I look forward to looking at your guys' videos and responding as well. Bye!